everybody. Thanks for being here. I'm so excited to be here, and I'm really scared as well because CQ is something that I really love being part of, but also CQ seminars are high caliber. I come up and show up, and I get lots out of it every time I show up. So this was something I was dreading to do for a while. But at the same time, it was kind of fun to prepare for, knowing that people in the room have gone through some of the stuff that we are talking about, so we can have informed conversation about it. So we are coming from the place where we feel that you know what we're talking about, and if you don't, please do ask us questions so we can clarify. We hope that we will have some time for discussion at the end. Ron and I are in different places, but we met at graduate school in Ann Arbor, Michigan, where we got trained in social work and social psychology, which was a joint doctoral program. And through the years of training, so we know each other for 20 years. And we met when we were 4. Yeah, both of us had strong interest in stereotypes, oppression and discrimination, all the fun stuff, like racism, sexism, and social justice. And also how social work address these issues in practice. So we talked a lot because we took many classes together, and we went through many phases of program together. And we nurtured common interests, even though we took on different kinds of methodological terms, which he developed as mostly quantitative researcher of various kind of things, and I have developed to be more of a qualitative researcher, doing community-based research. But in the past, 5-6 years, Ron has turned to more community-engaged research, has conducted four voice, and that's where our conversation also started to deepen in that regard as well. Even though we have always worked together on the issues of oppression and social work practice, such as anti-oppressive practice, critical consciousness, and how to raise our critical consciousness to be better practitioners and educators. So these are some images from the stuff we're going to talk about. So, and some of you may be new to community-based research, so we are going to go through a brief overview. And as in the title, Dirty Laundry and False Advertising, we're going to go through dilemmas we faced in conducting community-based research and examples from our projects, and hopefully we're going to have some discussion time at the end. I realized if I'm here, you can't see. So often do they hear that they are good for nothing, know nothing, and are incapable of learning anything, that they are sick, lazy, and unproductive, that in the end they become convinced of their own unfitness. This is from Paulo Freire. Effects of oppression. So this may be familiar to you as well. In response to situations like this, many people, many of us, may have experienced, many community folks might have experienced, may experience, there's an urgency of theory, as Janet Finn calls it. I came to theory, this is Bell Hooks. I came to theory because I was hurting. The pain within me was so intense that I could not go on living. I came to theory desperate, wanting to comprehend, to grasp what was happening around and within me. Most importantly, I wanted to make the hurt go away. I saw in theory a location for healing. So here, theory is not a big theory like Marxist theory, but theory as in many sizes. Local theory, middle theory, maybe indigenous theory to capture your day-to-day experience, to experience your phenomena, your experience, and something that speaks to you. And so this is a theory for survival. So then that knowledge, that thought turns us to also decolonizing methodologies and indigenous knowledge. Linda Tuhira Smith, Maori, and this is a famous book that really rewrote landscape in research and really made us realize the deep and so ongoing work we need to engage in our research endeavors. So globalization of knowledge in Western culture constantly reaffirms the West view of itself as the center of legitimate knowledge, the arbiter of what counts as knowledge, and the source of civilized knowledge. So this is big. This is many people coming from a different or oppressed or minoritized backgrounds might come into dominant knowledge space and may see themselves not reflected in the knowledge. Asian rich feminists also said something similar to that. You look into the mirror, you don't see yourself. And what do you do? She called for decolonization. Decolonization is about centering our concerns and worldviews and then coming to know and understand theory and research from our own perspectives and for our own purposes. And reflecting on our own standpoint, recognizing different ways of knowing, and moving toward decolonizing our knowledge base, documenting local indigenous knowledges in plural, are very important. And also as researchers who are differently located, it's really important to know who we are before we hit the ground running doing research. And in doing so, indigenous research methodologies do exist, but also there's a space for community-based research, community-based participatory research, and as an example, photo voice are something that we're going to talk about today. This is a topic I can't really. This is this day or days or years of lecture that I can do on this topic, so I can't really do justice to that. So I apologize that I'm skipping over lightly, and I'm not doing really justice to that. But that's sort of the back of my mind. How to coming from Japan, also not seeing myself in the mainstream psychological research knowledge that I was studying in University of Michigan. That was also the place where I had to come to the place asking myself, where is my knowledge coming from? Why am I not reflected in that? How do I insert myself? Those are questions I had to carry with myself through the 20-some years of being in the academy in North America, while also being assimilated into the dominant hegemonic knowledge structure, and also challenging myself. Okay, well, what I think is sort of mainstream and sort of hegemonically and excluding people like myself. So that was also a good reminder for me, even though I'm in a privileged location right now. Community-based participatory research or community-based research. In Canada, many people do use the language of community-based research. This is from Sarah Fricker and Beth Sedum, June 2006, Snapshot of CBR in Canada by Wellesley Institute. CBPR comes out of public health in the US and often used in health field in particular, but the premise are similar or same, as research approach developed out of a recognition that traditional social research has failed to reflect the needs and interests of communities with limited power, and strive to recognize the strength of the community as at the core of the research endeavors, a form of resistance to traditional status quo in knowledge creation usage. Often framed in a way of university-community partnerships, but it doesn't have to be so. Community members, community agencies, community folks themselves can do research. For example, local institute was a strong force for a long time to create research project and support research out of the US, like farmers conducting research. So it sort of takes us out of the box of, oh, you need to have funding to do research. No, it's not always that. Continual involvement of people who experience social issues firsthand. Much of the literature talks about equal partnership, but I also question that ideal. That's not always plausible or possible. I think it's great, ideal, but it's not always possible with the continual involvement. Aim to bring about community and social action. This is from often cited definition of CBR. So recognizing the strength, action, outcomes, and research with the community, not in or on, as in traditional research models. Researching community share control equally, which is always very difficult and hard to implement. In sort of theory, it's good to do, but how? Like, who has the money? Where does that money go? Who has the knowledge? Who keeps the knowledge? Where do you keep the consent forms? Those little, little really of research endeavors really affect the power structure too. Data are shared. How do you share the data? Forever. To keep it safe and confidential. So those are real issues too. But that's sort of the ideal way of doing CBR. And ethical dilemmas. So here, I think in abstract we said 4. We pared it down to 3, given the time frame we have. So first is dirty laundry. To what extent can we air the dirty laundry that people might have in the community? Any community might have dirty laundry. Any family may have dirty laundry. Mine has. And do you want to just go ahead and announce it? Outside of coming to your family, do you want them to announce what your dirty laundry is? Representation and power. Who speaks for the community? Diversity and power dynamics within a given community, which, any community will have power differentials. And who speaks for the community? And there may be gatekeepers, there may be community agencies of differential powers, or there may be agency head and participants, or there are just different structures, not just with researcher versus community. False advertising. To what extent should or can we commit to community and social change when changes are slow? So those are issues, and I would say that we didn't invent these issues, and you might have seen something similar to this, or you might have encountered these issues in your own work. So we don't patent this. It's not like we invented this. Dirty laundry and false advertising are the sort of names that we came up with. However, the concepts might have existed already. So I just want to make it clear. It's not like this is like rocket science that we came up with today or something like that. And now here, Ron, can you go through this?
Sure. So as Izumi said, so this talk is going to focus more on these ethical dilemmas that we all oftentimes face when we're doing community-based participatory research. And for us, we started to think about, well, how do we deal with these dilemmas? And we went back to a framework that we created, a framework for understanding critical consciousness and the development of it. And as we talk today, we will at least try to apply some of these components of this model to try to think about how we dealt with the dilemma. So our model for developing critical consciousness was really one, I think that Izumi may have it in her slides where we have a reference to this article that we have. But I'm not going to go into detail about all the components of it, but I'll describe it very quickly. We see the development of critical consciousness as being something that occurs at a personal level, and then something that also occurs at a structural level. But it's a cyclical process that's always occurring. So the key is that it's this continuing process. So at this more personal level, it's this negotiation with identity and coming to understand what your identity is, and that your identity has these power. There's these power dynamics associated with that, with your identity, and that identity becomes this lens that you look through. And when you're doing community-based participatory research, it's more as a researcher understanding that lens that you're looking through and the power dynamics that are associated with it, and just being very cognizant of that. But at a structural level for us, it's more about thinking about the power differentials. I mean, the easy thing is to think about as a researcher going into a community and what are the power differentials there. But the power differentials get played out in other ways within the community also, and also being cognizant of that. Because again, as a researcher, I can say like a teacher-student trap where we have that in our model. The researcher coming in and thinking that they're the expert, and coming to realize that the community is really the expert of their own experiences. But also, I think as a researcher, being aware that this teacher-student trap can show up in the community as well, and being very cognizant of that. So it's this notion of understanding the teacher-student trap, and then who needs to take this one-down position. As a researcher, it's easy to say that we can take a one-down position and try to understand the community from their own perspective. But we try to push ourselves to thinking that also as we're doing community-based participatory research, that some community members may also need to take this one-down position. And for us, this development of critical consciousness and remaining critically conscious is, as a researcher, is still asking ourselves, do some of our participants in our study, do they need to also take this one-down position so that they can get to this notion of getting to this shared power? I know Izumi said that it's a difficult concept of shared knowledge and shared power, but ultimately, in our model, is this we're aiming for this notion that you have this egalitarian moment where you have this shared knowledge and shared power, but constantly it's a cyclical process. And for us, as we thought about the dilemmas in our own research, we kept going back to this model and thinking about how can we as researchers remain critically conscious. So Izumi, I'm going to move to the next slide.
Okay.
So dirty laundry, the first ethical dilemma. That one. So Izumi, do you want to read this right here?
Sure. So although this word dirty laundry is not used, this is Poka and colleagues mentioning another ethical issues related to CBPR is how to handle information that might cast the community in a negative light. So reporting this type of information may well be damaging to the community or could weaken the community's trust in the research process. And they are suggesting that to address this issue, they developed a memorandum of understanding that clearly delineates how we will handle reports and publications resulting from the research project. So okay, do you wanna talk about that, Ron? Next slide.
Oh, okay. So the next slide, I will talk about my research study, just a part of it, because as I think about the ethical dilemmas, many of these, our research team struggled with this particular project. The research project was called From Snapshot to Civic Action, Creating Healthy Environments Through Community Engagement. And it really was focused on a public housing community here in Columbia, South Carolina. This public housing community is the oldest public housing community in Columbia, South Carolina. And it's stigmatized because it's not only has people who live there who are living in poverty, but it also has a very high crime rate. So our research was squarely centered in that particular community. And our aim was to reduce crime and perceptions of crime among the public housing residents who live there through what we were calling community-generated, community-level, and community-engaged interventions. So it was actually a 3+ year study project where the first phase, we were very much interested in understanding things from the residents' perspective. So we engaged residents in this examination of community concerns and also their community strengths. And we did that by using photo voice. The second phase of our project was really about building the capacity of the residents who lived in that community through the development of community-generated, community-level, and community-engaged interventions. And then the third phase was them enacting the interventions. So for this particular talk here, I will more focus on the first phase and some things that we came across when we were doing photo voice. So photo voice, as I'm looking at this, I realize it needs to change the slides a little. So the photo voice example of CBR art, or Izumi, do you want to read that?
Sure. How many of you are familiar with photo voice? I think there was a seminar about this. So maybe 1/3. It's an example of community-based research or participatory action research developed by Caroline Wang and Mary M. Lewis. Caroline Wang is a public health professor at the University of Michigan. And it's a process in which people, usually those with limited power due to poverty, language barriers, race, class, ethnicity, gender, culture, and other circumstances, use video and photo images to capture aspects of their environment and experiences and share them with others. The pictures can then be used, usually with captions composed by the photographers, to bring the realities of the photographers' lives home to public and policymakers and to spur change. Often it's done in group settings so that people who experience social issues firsthand can also do a reality check and sort of give feedback to each other in the process. And since its inception, so it has popular education idea, Freudian idea, feminist theory, and documentary photography as underlying sort of ideas. And since its inception in 1990s, it has taken quite a bit of popularity. So there are thousands of photo voice research studies you can find online if you search them. Okay, Ron.
So, I mean, for us, and we used photo voice in our project to start off with because given that this public housing community was very stigmatized, that they were also very used to researchers from the University of South Carolina coming in and doing research. So they were suspicious of researchers coming in. We didn't want to come in from this top-down perspective, so we wanted to use this bottom-up approach and try to understand the community's experience. And photo voice was that. It was an avenue, for us to examine that. So for us, it also, I think it gave us an opportunity to hear perspectives of people who didn't talk much. Because then when we first went into the public housing community, there were some people who were wanting to participate immediately in the project, and then there were some people who really didn't. And photo voice sort of equaled the playing field in a way where even people who were really quiet, they were able to take pictures and write captions. And for us, we had 18 participants who participated in photo voice. I think that there were about 11 youth and the rest were, 11 adults and then the rest of them were youth. They took photos we went through all this training, and then ultimately they chose their 10 best photos that represented strengths in their community and concerns in their community. And what we did is, after they wrote the captions and took the photos, we put them on display for 3 months at the University of South Carolina's Art Museum. So what you're seeing here are 2 photos. The first one was by far the most popular photo. In our research that we did, we had multiple people come to the exhibit to look at photos, and then we had them rank the ones that most spoke to them. Overwhelmingly, the slide that you see that says Stronghold, that one was very, very popular. And here, the artist, I put the artist's name there because they're residents, but they wanted their names on their photos. This one was one representation of, the artist says that it was a strength of the community, but many of the observers of the art felt that she was pointing out a concern in the community. And here it just simply says, the little girl is not wearing a shirt. She's holding the baby's hand as the 3rd child follows. The baby's diaper is nearly down to his knees. None of the children are wearing shoes, and it rained that day. This happens regularly. The eldest child is responsible for taking care of the younger ones. They are all just babies who are left to police themselves. This is not right. These children are stronger than they ought to be. And then another representation came from a youth who took a photo, and here it's like so simple of taking a photo of KFC, but she called it, "Can I take your order?" You might never know what you'll see when you go around the window. You might see a dead person, so you might want to be careful. And here the youth was pointing out that there's a lot of high crime in the neighborhood, and that definitely there was a murder that occurred right by this KFC. So these were some representations of the photos that came out of the first phase of our project. But for us, this notion of dealing with dirty laundry it was something that we hadn't thought about initially as we were developing the project. But when we started to think about, well, let's put these on display at the University of South Carolina Art Museum, then that became this issue of dirty laundry and what gets aired. The public housing, as I told you, that all the public housing communities are stigmatized, but this one that we were working in was very stigmatized. And the Columbia Housing Authority, they're the ones that are in charge of who gets placed in the public housing community. But also, they were key stakeholders. We knew we had to connect with them if we wanted to do research in the public housing community. Because if you went directly to the public housing community and not go through the housing authority, they would automatically reject the project, and they wouldn't allow you to do research in the public housing community. So they were key stakeholders. We had to go to them. It's a very hierarchical setting in that everything had to go through them. But then we realized that they were also gatekeepers. They determined what researchers could do research there. But then they also wanted to see what research was being produced. So for us, it came down to this issue of, wow, we have this higher figure that we have to always go through, because we know that they had a lot of control and they could shut down our project at any time. But in a way, they were also very concerned about what messages were coming out. And maybe that could be understandable, given that they know that it was a very stigmatized community. They were very, very concerned about how researchers come in and just come out and say negative things about the community. So for us, this was one of the dilemmas that this created. I mean, we had to draw on trying to think about the critical consciousness and our own identity, because for some of the photos, we weren't thinking anything about it. And the lens that we were looking through, it's like, oh, this is so benign. Yet the Columbia Housing Authority saw certain photos and they were saying that, look, you don't live in this community, you don't understand that this is going to have a negative impact on the community. So in many ways, we had to try to develop and deepen our critical consciousness and recognize power differentials. But what came out, I mean, research, this kind of research, we don't know what there is. It's emergent. It's an emergent process, and you don't know what's going to come out. We don't know. We can't completely prevent potential conflicts with authority figures or community members. And even though we also work with MOUs, the MOUs only covered the beginning things, and we didn't know all things that would come out. But when we wanted to do our exhibit at the museum, the Columbia Housing Authority said that they wanted to see all photos. And they said that they wanted to approve of what photos could be on display. So at first we thought, wow, are we being true to community-based participatory research if they can tell us what photos can be displayed? But they told us that if they didn't go through that process, then they wouldn't allow any photos to be displayed at the museum. And there were a few photos that they really felt, when it comes to this issue of dirty laundry, they felt were offensive and would send the wrong message about their community. And at first, as a researcher, our research team said that, oh, we think all the art should be on display because they came from the residents. But they again told us that if we didn't take out certain art pieces, that they would nix the project altogether. So we took out those pieces, and we try to understand why they were saying that. We don't think that affected our project in any way. We think that the photos that were up on display represented the strengths and concerns of the community. But this issue of dirty laundry definitely came up for us, and this notion of the food for thought was, does every aspect of data from participants have to be aired or shared? That issue really came up because we were trying to be very true to community-based participatory research and what gets aired, who gets to air it, but then that question for us remained, and it was a dilemma. So, Izumi, I think I'm done with that.
Okay. All right. So time check. It's 1. So we're gonna pick up the pace.
Oh.
Ethical dilemma 2. Representation and power. I think I'm gonna go through this part quickly. So related to the issue that Ron just talked about, who represents the community, and what the community is another matter. And we often say community, and that might mean many different things. Community may be uniform for poverty, or some people may just mean community agency. But CBR, it's usually about residents or people who experience the social issues firsthand. And whose voices count more? For example, researcher versus community members, or community institution versus the residents in the case that Ron just talked about, or among community members, there may be differential power. So the model of critical consciousness Ron showed earlier, so these are some of the parts. I'm gonna go quickly. And Ron, for Voice Project, address the issues of power. What you did was?
Yes, so it's more this notion of power. Again, the easy thing to think about is the researchers coming in and having more power. But we realized, so we were very cognizant of that. What was interesting is as we started doing our research in the community, you know, as you all do community-based research, you always have these key stakeholders who are really nice to reach out to because they can serve. They help you in the community. They connect you with different resources, and we immediately saw those key stakeholders. But over time, we realized that the key stakeholders had a lot of power, and we were hearing perspectives, but it was coming from these key stakeholders and people they were putting us in touch with, and we started wondering, well, what voices were being missed? And here was this notion of thinking that the key stakeholders possibly needed to take this one down position. And for our project, we just as a team developed this emergent leader program where we were trying to recognize other people in the community. we value the stakeholders, those key stakeholders, but we intentionally put this program in place to recognize other voices, to get other people involved in this process. So that was our way of trying to deal with this power differential, because the power differential was a strong one with the key stakeholders who didn't seem to want to give up any power. So Izumi?
Okay, so I'm going to go through this quickly. In terms of power and representation issue, this is another set of projects coming together: homeless women, housing and social support. It was a collaboration of myself, Region Park Community Health Center, and sister in Women's Place, focusing on the social support, how women help each other, cis women, trans women help each other when housing an issue. With the reflection that often homelessness is talked about from sort of charity model or people without agency. So it's just a three-phase collaboration and advisory board consisting of cis women and trans women who have experienced homelessness, and they decided they made key decisions in that research, as including the final images to be used for knowledge mobilization. By the way, this was arts-based research using staged photography. However, once we have posters ready, we have 4 posters that we created by different themes. And there was one complaint in the feedback sessions. We went back to 4 drop-in centers we did arts-based focus groups in. And it's impossible to get the same group of people who participated in these art focus groups because of the nature of the population. So there are no participants who are in these feedback sessions as well. That these images are too cheerful. And these complaints came from indigenous women in particular. So we took that very seriously. But at the same time, we came from a place where we didn't want to do pornographication of poverty. We didn't want to put misery on display just to get sympathy from people. We didn't want to take that approach because we knew that people were helping each other out to survive. So we wanted to focus on that. However, it's true that images were probably strong and empowering and not capturing some of the realities that people are facing. That brought us to the question of truth in singular versus truth in plural. We were not trying to promote the truth in a capital T. However, people who saw the images might have thought that that's the definitive image of homelessness of the people women experience, which was not what we were trying to do. So what we did was that Coming Together project led a broader collaboration for increased knowledge mobilization in sustaining peer researchers' momentum. And this was a collaboration of 8 CBR projects on homelessness, 7 of them arts-based research. And there's also a video about collaboration on YouTube if you're interested. It's called Working Together. 19 team members, 9 organizations. It was herding cats is how I was herding cats. And it was extremely fun and extremely tiring at the same time. And we had different teams. 8 of our research projects involve people who have experienced homelessness, poverty, firsthand as peer researchers, and 1 funder, which is Wellesley Institute, as partners. Images of people. Goals: transfer knowledge, disseminate collective findings to a broad audience, and really to mobilize and do more, because CBR knowledge come up, accepted, sort of recognized, but it may go away. but there are multiple studies focusing on homelessness. We wanted to capture the moments and go further. Also, peer researchers participate in each project, but what's next was not there, not clear. So we wanted to create more opportunities for them, so that can lead to something more sustainable. So we have collaborative exhibit, policy recommendation report, website, and launch event. The key message was inclusion and accountability, focusing on diverse cases of homelessness. Policy report available in Rose Institute site. An exhibit was organized by the Midson Wheel. This was the point of conflict in a collaborative team when we were herding cats. Like we, laughingly told each other, we are herding cats, each other, we are all cats. The creative team that were in charge of aesthetic aspect of exhibit had Cindy Baskin, the professor from Ryerson University, Indigenous scholar, as the sort of leading figure, and a peer researcher who was also Indigenous, and a couple other people. And they came up with the idea of using Madison Wheel as an organizing image to have all these 8 projects lined up in a metro hall in city of Toronto. Because we call indigenous people homeless in their own original land in a disproportionate way, which is very ironic and shameful. So how about we line ourselves up in their knowledge, in the meaning, to look up ourselves. So the different directions, that, for example, Coming Together project was focusing on relationship. So that was placed in the south area. So we placed each project in quadrants, so different directions. So that was the idea. However, Cindy is busy in summer, as with many indigenous people, going back to their home communities and so forth. So this was done in 9-month period, very intense work. In summer, because I had to do this before my tenure review, so I had to do it really quickly. Got the grant proposal written in December. Money came in March. We had this exhibit in September, October. So it was really busy work. In summer we had to decide what to do, but Cindy was gone. She was a strong voice, and we had to decide how to carry this. And we wanted to have this Madison Wheel drawn up. One artist came in, indigenous artist came in and to the meeting, and he got upset because the Madison Wheel is not a design. I can't do it. He got upset and left. So that's when some of the team members said, I'm not indigenous. Most of us are not indigenous. This is appropriate. Let's not do this. And where some others of us said, oh no, this came up from creative committee, and we decided to do this. Let's do this. So there were quite a bit of discussion and contention. So who represents whose power, how to decide. At the end, we were able to have another indigenous artist who was happy to do this and saw the meaning of doing something like this, and was able to do it. But it was quite a bit of process, and so it was quite a bit of process to resolve, and took some time to do that. But result was this. This is a launch, peer researchers panel. This some of the images from the projects, our exhibit, Coming Together project, I was here project, peer researchers. So moving right along, you're at Epidemic 3, false advertising. To what extent can we commit to community and social change when changes are slow? Okay, I keep talking. This is a totally different project, Canadian Experience Project, which is employment challenges faced by high-skilled immigrants. Many skilled immigrants are from global south countries, and they face this dilemma. They have credentials, education, experience, and they show up, and they were told that they don't have Canadian experience, therefore they cannot be hired. Regulatory bodies also discriminate, saying that a Canadian experience is needed. Architects need to need 1 year of Canadian experience before they can be certified. Engineers, same thing. So it's however, Canadian experience is often an ambiguous term. There's no set definitions. It's a moving target. It's a subjective term. It's used whenever it's convenient. So we turn to arts-based research to capture the meaning, elusive meaning, tacit knowledge of Canadian experience. Masks were very salient images that came up from focus groups. I can go through this. The theater informed arts-based research that we have done. And out of that, also we had Leaders Theater, the Theater of Canadian Experience, Canada's mixed newcomer professional. There are lots of, majority of words used, text used, scripts were verbatim from script, focus group transcripts, and was organized in the format of game show, where newcomer professionals are trying to get a job in a game show format. Employers, for example, in our interviews said fit, risk aversion, community trust, soft skills are important. So we have those as key concepts. And we had good reviews from audience, skipping right through, and also Beyond Canadian Experience project was a knowledge mobilization project following after that, and using this as well. And together we contributed to the Ontario Human Rights Policy on removing the Canadian experience barrier released in July 2013. This was timely because I was engaged in multiple projects focusing on Canadian experience. And when we were doing this was the third project I was leading, and Ontario Human Rights Commission found me, and they were starting this process of looking into this concept. So I was called on to do consultation, and then the project was called on. Beyond Canadian Experience Project is community university collaboration as well. So this basically says that strict use of Canadian experience as a requirement for employment is discriminatory in Ontario, and so as for accreditation. So it's a strong statement, legal statement. So we see it as a victory. There's quite a bit of media exposure. However, the experience of racism still continues. That means the impetus to use Canadian experience may persist. If not Canadian experience, there are other ways that people discriminate immigrants. So we achieved something out of all these efforts, years of research. To what extent would we continue with advocacy long after the funding ends? To what extent do we keep going? How can we help maintain the momentum of community-based researchers, peer researchers, people who are not getting paid? For example, in the Beyond Canadian Experience project, key people like steering committee I worked closely with, doctoral student who was getting paid from the project, agency staff who's no longer in that agency head who moved on to another job. So there's no sort of core group anymore to lean on. So then what should we do? At the same time, demand for accountability and measurable impact also comes from the neoliberal culture in research. What's the measurable outcome of the research is something that we hear all the time. Or should we say documentable process? Because we may not have a clear outcome. When you do A, therefore B, it's not that clear causal outcome, right, in life. So maybe we should document the processes. Institutional pressure exists to publish peer-reviewed journals, especially for junior faculty and doctoral students. That's for real. Secure new external grants. So if I keep coming together project, funding lasted for 4 years or 3 years, and I keep doing it for 8 years. So that's out of my own time and work study students and whoever comes along. But or beyond Canadian experience project, there's no funding for that. Should I revive it and then blame it through? So there's a pressure to move on and do something new, which I am doing, but so this also, you are accountable for the people you talk to, and that's something that you took on already. So can you divorce yourself from these issues? What two partners agree on at the onset of research? Also, if people involved in CBR are truly equal partners, the commitment to achieving outcomes come from all those involved. So then why am I thinking that I should revive Beyond Canadian Experience project? And other people can do it too. But at the same time, power differentials and different access to resources mean that a doctoral student without support cannot just stand up and start doing. That would be very difficult. Or agency staff who's had a very different job in different agency cannot convince the agency to start doing something. So that's a reality too. What kind of change are we aiming for? And so fundamental shift may happen as a result of generational efforts and accumulation of small changes. So when we say CBR aims for change, what kind of change? And how can we document or how can we claim that change in CBR? So these are 3 things we talked about. Given these dilemmas, what can we or should we commit to with the community members and research partners about the outcome of the CBR projects at the onset of the research? This is another attempt to summarize what we just talked about, CBR knowledge dissemination and ethics. So I came up with phases, identifying key messages from the research findings, and get the key messages out. Dirty laundry, get the key messages out. What's the research in false advertising? How do you build the capacity of the community to sustain positive changes in the absence of external support? In all phases, we need to raise critical consciousness for all parties, but especially for outside researchers with no power. So that is wrapping up our messages. But again, I think that what we talked about might be something that you already have experienced in your own research endeavors, as many of you are experienced community-based researchers as well. And some of you might be starting to do research, and I would love to hear what you think about it. And this is again the figure, the diagram Ronald and I came up with in 2005 about critical consciousness.